Good day everyone, my name is Kate Angel Di Balut and I am nursing student at Pamantasan ng Luzon, Marikina. And today I will demonstrate the history taking of a patient. The main purpose of obtaining a patient's health history is to gather or collect subjective data from the patient or his or her parents so that the healthcare team and the patient could collaboratively make a plan to promote health and to address acute health problems and also minimize chronic diseases. The first step is to make sure that you read the patient's chart. It is very necessary in order for us to know if it is the right patient and also to have a background knowledge about the patient. Next is to make sure that we wash our hands before meeting the patient in order to avoid transfer of microorganisms and also to maintain the good hygiene. Next is to greet, identify the patient, and to introduce yourself to the patient. It is very necessary for you to do these things in order for you to pay respect to the patient. So good day sir, I am Kate Angel Libalit and I'm a nurse practitioner student at Pamantasan ng Luzon, Marikina. I will be completing your appointment for today. You should always state or explain the procedure to the patient in order for them to know what we are about to do to them and to understand what we are doing. So I have here a few questions about your health and some social circumstances. Is that okay, sir?
Okay.
Alright, so if you feel uncomfortable answering some of my questions, you can let me know, okay? It is very necessary to provide the client their privacy because it is a way of giving them respect. So if they're not comfortable answering a question, we just have to let them be because it's their privacy. Next one is to assess the environment and the resources we need to use in order to make sure the safety of the patient and also the medical condition of the client. We also want to make sure that they are be able to answer the questions we have to complete the interview. Identifying data and information about the patient is part of the patient education. It is necessary for us to get to know more about our patient and also in order for us to know about his or her background.
Sure.
So, what is your name, sir?
My name is King Angelo Di Baluyot.
How would you like me to address you?
Just call me King.
Okay, just call me Kate. How old are you?
I am 17 years of age.
And when is your birthday?
The birthday was on May 7, 2003.
Are you single or in a relationship?
I am single.
Okay. How can I help you today, sir?
I've been having this stomach ache for about days.
How long does the stomach ache?
For about 4 to 5 days.
Does the stomach ache radiate?
No.
So do you have any other symptoms other than stomach ache?
I feel like I am bloated and release gases often.
Does being bloated and the release of gas has been there since the stomach ache?
Yes.
Okay. So the stomach ache, is it does it hurt in a particular time of the day or night?
In every after meal, I guess.
Okay, so can you describe your pain for me?
I think the pain is crampy and sharp.
Oh, alright. So is the pain continuous or not?
No, I think I feel the pain every 30 minutes after meal.
Okay, on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst, what is the severity of the pain?
I think I can say that is 6 out of 10.
Is there anything that makes it feel better?
By drinking hot water.
Okay, so does anything makes it worse?
No, not really.
Alright, so do you feel anything aside from stomach ache, like breathing problems?
No.
Okay. Moving on, I would like to know any medication you have. This is useful in detecting drug-related pathology or changes in clinical signs that may be the result of drug therapy, okay?
Yes.
So, do you have any prescribed medicine?
Yes, I take Persulfate.
Do you know what is the dosage?
No, I don't know the dosage.
Okay, so we could follow up that. Okay, so do you take it regularly?
Yes, I take it once a day.
Are there any side effects along with the medicine you take?
No, I don't think so.
How do you take this medicine?
Uh, I take this medicine orally.
Okay, alright. I would ask these questions in order to avoid misdiagnosis, and also to, through this, we would know the appropriate medication for you, okay?
Yes.
So, are you allergic to anything like food?
No.
Okay. Any allergies on drugs?
No.
So, I really need to ask you this. Do you use any recreational drugs at all?
No.
Great. So, by any chance, sir, do you take tobacco or cigarette?
No.
Okay, great. How about alcohol? Do you drink?
Yes, occasionally I drink.
Oh, okay. What type of drink is this?
Just beer.
Alright. So, how many bottles of beer you usually drink?
I usually drink moderately, so I think about 2 bottles.
Alright. Okay, so right now I will ask you about your medical history. Alright. So, have you experienced any childhood illness like measles,
Yes, measles and rubella.
fevers, and cough?
Yes, yes.
Okay, alright. Knowing the family medical history is very necessary because it would be easier for us to identify people with higher than usual chance of having a specific disease such as the heart disease, diabetes, a certain cancer, and etc. Have you or any of the member of your family experienced jaundice or the yellowing of the skin?
No, none.
Okay. How about anemia?
Yes, my mother had it when she was around 14 years old.
Alright. How about you? Do you have the same thing?
Yes, I got a iron deficiency, and I got this when I was about 8 years old.
Is there any heart attack cases in the family?
No, none.
Okay, what about TB?
None.
Any thyroid problems?
No, none.
Any rheumatoid or arthritis?
My father and my grandparents also have that kind of illness.
How old are they when they have?
I think they got it when they are mid-40s.
Okay, that's right. Any heart problems?
None.
Any high blood pressure?
My grandparents do have
Okay, how old are they when they had this?
about 60 years old.
How about diabetes?
None.
Any gastrointestinal problems in the family?
My father has, which is acidity,
How old is he?
mid-40s.
Alright, any asthma in the family?
None.
Okay, so any cancers in the family?
My grandmother is a cancer patient, which she had the breast cancer, and she's now under chemotherapy and recovery.
How old is she when she got this cancer?
She got it when she was mid-60s.
Okay, so do you have any health maintenance like immunizations, vaccinations?
No, none.
Alright. So now these next questions are about your social and personal history. Is that
Yes.
okay, sir?
Yeah.
Social history is an ideal section for patient education and also to promote healthy lifestyle and behaviors to prevent future disease. So may I know what are your interests and hobbies?
My interests are sometimes I play mobile games, read a bunch of books, and play basketball, I think.
That's good. So do you have a job or you're still studying?
I'm still studying.
So how's school? Is it stressful?
Yes,
Fun?
it's kind of stressful and busy.
Yeah, so okay. That's great. May I know what is your religion?
My religion is Roman Catholic.
Alright. So do you exercise?
Yes, I exercise often.
That's good. So how often is it?
For about thrice a week.
Alright. So any diet or do you take supplements, vitamins?
Yes, I am on balanced diet, and I take and eat food supplements and vitamins.
That's great. So you've got a girlfriend or you're single?
I'm single.
Oh, that's okay. You're still young, but you're happy, right?
Yes, I'm definitely happy.
Alright. I will proceed to the review of your body systems just to define your overall health. Is that okay?
Yes.
Alright. So have you suffered with headaches lately?
Sometimes.
How often is that?
For about twice a month.
Have you seen a doctor for that?
No, I just intake painkillers and let it go away.
Alright. So have you ever had head injuries?
No, none.
Okay, good. But what about your vision? Your sight?
My vision is kind of blurry, so that I have to wear these glasses.
How long have you been wearing those glasses?
I'm wearing these glasses for about when I was in grade 4 and for about 8 years.
Alright. So do you ever suffered from nasal congestion or sinus problem?
No, none.
Okay, what about your taste? Does it change?
No, none.
Your hearing, is it
It's fine.
alright? So, do you have some sort of problems with your throat? Do you
No.
have sore
No,
throats?
none.
What about your chest? Having problems in breathing?
It's definitely fine.
Alright. So, your bowels working alright?
Yes.
So, good water works, right?
Yes.
So, the only hurting in your stomach is your stomach, right?
Yes.
Alright. So, I hope you don't mind, but I have some questions about your sexual history.
Sure.
Are you in a relationship?
No, I'm not.
But have you been doing sexual activity lately?
No, none.
Alright, good. So, have you been in a relationship?
Yes.
Okay, so are you heterosexual or?
Yes, I'm heterosexual.
Okay. How about your bones? Does your joint hurt?
No, no.
How's your mood? How do you handle things?
Sometimes I am short-tempered, but I think it's definitely fine. Part of the mood.
Yeah. There are no sleeping problems?
No, none.
Alright. So, any hematologic problems in your blood?
Yes, I got a condition called iron deficiency.
Alright. So, you've been taking Fersulfate for that?
Yes.
Right? Okay. How about surgeries? Have you been in surgery?
No, not yet.
Alright. Just to summarize everything, sir. You came here with the stomach ache and you are bloated and releasing gas often, and it usually occurs every 30 minutes after meals.
Yes.
So it does not radiate and no other symptoms.
Yes, precisely.
Okay, so you have iron deficiency
Yes.
and you're taking Fersulfate. You have no allergies to any food, drinks,
Yes,
and
none.
drugs. You
None.
do not use any recreational drugs.
Yes, none.
And you've been drinking alcohol occasionally and you're not using tobacco and cigarettes.
Yes, correct.
Okay, is there anything you want to add to that or before we move on?
No, none.
Alright, so what we need to do now is to check your vital signs, and I have to examine you before we will know further about what's going on in your stomach. Alright?
Yes.
So thank you, that's all.
Thank you.